Well, good evening and welcome everybody to another edition of Ask the Doctor. We are going to cover children's health. The speaker that we have tonight, of course, is our friend and mentor, Dr. Bob Rakowski.
Well, Carol, thank you always for the beautiful introduction and running the show and monitoring the chat and being moderator. And by the way, if you have questions as we go through this, please type them in the chat. But absolutely a topic near and dear to my heart, and I think to everybody who is a parent or wants to be a parent or maybe knows some kids that they're fond of. Children's health has been really a challenge over these recent years, and we'll show what the parents' top 10 concerns are now. So the most recent list I found was 2020, and we'll find out that there was a virus that made that list, but we'll actually share that it's really not risky for kids. In fact, less than 2 of 1,000 deaths occur in people under the age of 18, and they usually have something serious going on. But we'll show you the data right out of the CDC. And then this week, other questions came in. A lot of them fell into the balance of these top 10 concerns, and I addressed them, but I'll address them again. And then there were a few that didn't hit it, like the vaccine schedule and the hormone challenge issues, especially with young girls. But let's just go ahead and dive right in. So when you start asking adults, and by the way, this was a 2016 survey, and I think if we upped it to 2022, and I couldn't find anything more recent than that, parents are very concerned about the quality of their kids' life and health compared to what they had to deal with. And we're really just talking one generation ago. You start going a few generations ago, and things are very, very different. So, in 2016, they said kids had less quality family time, that they had less coping and staying positive skills, that they had lower levels of quality and personal friendships, and that their stress was significantly higher. And we'll show that after 2020, that stress absolutely skyrocketed, as did substance abuse, as did obesity, as did anxiety, as did depression, as did suicidal thoughts. So we really, really want to know what's going on and take exceptional care of our kids. Now, I found these concerns interesting in that they were split by a demographic. And then you start looking at the graphic, and they're showing these kids wearing masks, which, I think the debate's been solved. They don't work, and kids never should have worn them. But again, this was a 2020 survey. But you see the different demographics having different things that came up as their top concerns. But here was the consensus of it all. So overuse of social media, I'll show you the numbers on that. It's staggering. I had no idea that the use was as high as it is, but as parents, we need to get a hold of that. Now, I'm a grandparent, so I don't have any kids at home, 3 beautiful children and grandchildren, but I certainly will share these thoughts with my kids and my grandchildren. Then there was bullying and cyberbullying. So that's a whole new thing compared to a few generations ago. Internet safety, unhealthy eating, that's a bigger problem than ever. Depression, suicide, lack of physical activity, stress, anxiety, smoking, vaping, drinking or using drugs, and then COVID wrapped out the top 10. That was in 2020. I'm not sure in 2022 that it would hit the top 10 anymore. But this data was compiled in 2021. And for kids 8 to 12, they said that screen use updated to, I highlighted the wrong thing, 5 hours and 33 minutes per day for kids 8 to 12. 5 hours and 33 minutes every day of screen time for kids 8 to 12. And then you go 13 to 18, 8 hours and 39 minutes a day. That's, to me, almost unimaginable. Now, it's not just internet time, some of it's TV time, but oh my gosh, we've got to definitely do something about that. And this was a Journal of the American Medical Association pediatrics version talking about depression and social media. And here's what they found, that every hour that kids spent on social media, the risk of depression increased substantially. So you start looking at that. And if you read the article, kids were often comparing themselves to absolutely unreal ideals. And there are people out there, I don't think most people, are gonna, put a bad picture on the internet, so to speak. They're always trying to put their best foot forward and make it look like their life is the greatest thing. And I hope their life is the greatest thing, but a lot of that's just plain fluff. And I don't think a lot of our kids have the discernment to realize, okay, that's not true. I'll put my best picture up, but I'll have my best moments and my less than best moments. When we start talking about online safety, this is a whole new phenomena. And I really like this acronym of SMART for online safety. So the first S is secret. Keep all of your personal information, a secret, maybe even your name. There are people online that have aliases. Big number two, never, ever, ever meet, unless there's a parent or guardian present, because there are people that are sadly cyber stalkers. Don't accept messages, emails, or requests from unknown people. I'll tell you what, I have accepted friend requests from unknown, and it's usually just a few messages and people are asking for money. And you know what, if someone's in desperate need, that's one thing. But then I say, okay, I've got a friend in that town, go meet them. And let's make sure you're a real person. Well, guess how many times that happened? So far, zero. So crazy. There are people scamming on the internet. And, as an adult to get scammed, well, shame on us for being foolish. But with kids, it can be a lot more risky. So the R is reality, and remember reality. So people don't tell the truth on the internet, including having aliases. And then tell basically an adult if there's something that appears off in any communication with anyone ever. So, when my kids were growing up, there was this, cartoon basically about stranger danger. And it's gotten to the point where, anybody could be talking to kids online and posing, who knows, as an 11-year-old kid. And, we just have that type of world where we need to be aware and we need to look out. So number two concern among parents, very, very, very valid concern. The next was about unhealthy eating patterns. Now, this is pretty fascinating about the amount of overweight kids. And notice what it said, rate of countries where at least 10% of children and teens are overweight. And in upper and middle income countries, we get to 100% are over 10%. And look at how even these lower income countries are catching up so quickly. Now, what percentage of kids should be overweight? How about almost none, unless there's a very significant metabolic abnormality? Maybe that'd be 1 in 100. And I was having this conversation with a patient the other day. But when I grew up, and now that was a while ago, I was in grade school 50 years ago, but we might have had 1 or 2, heavy kids, obese kids in the entire school, and now all of these developed countries have at least 10%. And those numbers grow, no pun intended, every single year. Then when we start looking at these obesity trends, and I'll show you the next slide, physical inactivity, the obesity went up and up and up exponentially with COVID because a lot of social interaction, organized sports, so many things were taken away from kids. And as the data shows, really for no good reason whatsoever. And while we're talking about nutrition, very important, baby's brain, that's going to be the most important organ in the body. It's made mostly of water, but the primary structural component is fat, and the primary fat is an omega-3 fat called docosahexaenoic acid. And here's a fact, over 95% of childbearing age or pregnant women did not ingest the recommended, which I'll say is a low recommended amount of omega-3s. So we have this whole generation of kids being born with suboptimal brains, and we're seeing the effects of that. And this was an animal study, rat study, because they wouldn't do this to humans, but they gave animals purposely an omega-3 deficient diet. And they found that mother's brain could shrink as much as 21% in a single reproductive cycle. Now, I might ask, do you think that would be a reason for postpartum depression? And then also think about new moms, new stress, lack of sleep, lots of things going on there. So we really want to go the extra mile to educate our soon-to-be moms or, moms that are currently moms, and really, really go the extra mile to take good care of them. So now when we look at physical fitness, look at the nosedive that it took in 2020. Basically, kids started eating junk, getting online, not doing physical activity, being exposed to a whole bunch of garbage. And keep in mind, every hour on social media increased depression. The study didn't talk about anxiety, but we'll show you that soon. That's the real pandemic. Ill health, poor nutrition, lack of physical activity, depression, and anxiety are what are riddling our kids. So if you were to look at suicidal thoughts during the pandemic, and by the way, this was just August of 2020, look at this. 1 in 4 young adults, more than 1 in 4, at least had suicidal thoughts, and 1 in 9 in absolutely all ages. So you start looking at that and realizing what in the world is going on here. So when I used to do daily updates, there was something called the Cobra effect. And it was a story about how in India, they put a bounty on cobras. You know, if you brought a dead cobra, and for animal lovers, sorry about that, but if you brought a dead cobra, they would pay you a reward. Well, people got clever and they started cobra farms and they started breeding cobras, and then they bring in dead cobras by the truckload to get a, you know, essentially a king's ransom. And then the government said, okay, that didn't work. And they stopped the cobra bounty. Well, what did the cobra bounty farms do? They let all the cobras go. So the outcome was much, much worse than the start. And people in the know are going to say, yeah, that's exactly what happened with the policies during the pandemic. So now we start looking at the effects of pandemic on mental health. Now, girls are much more vulnerable to mental health issues. And here's a very simple reason. The female brain is profoundly different from the male brain. And if you've heard me talk about this before, if you took a brain out of the skull, you know, so the person's not with us anymore, if they took a female brain out and put it on the table, put a male brain out and put it on the table, you could tell the difference just in the structure of the brain. The female brain is much more complex, much more interrelated. There's not multitasking, but there is task switching, and females are masterful at task switching. So, you know, that's why they can take care of multiple kids and jobs and, you know, mates and a bunch of other things at one time. And they appear to be magicians to males because, you know, we can only keep track of one thing and we're not very good at that most of the time. So that complicated brain makes it a lot more vulnerable to depression, anxiety, even sleep issues slightly. And I found it fascinating, not a good thing, but even females had more aggressive behavior. Now, this was the increase of aggressive behavior. So boys are generally more aggressive than girls. That's just part of being a boy. But the pandemic aggravated that more in females. So our young girls really paid a price. When you start looking at this, you know, vaping and smoking, NIH.gov, you know, almost 1 in 5 8th graders, more than 1 in 3 12th graders have been vaping within the last year. And what are they vaping? Well, either nicotine, marijuana, or some type of flavoring, which, by the way, you know, the flavoring is not benign. Any type of inhaling a hot vapor has potential challenges. So here are the stats on vaping. 48% increase, middle schoolers, 78% increase in high school kids, and that can lead to nicotine addiction. I've never smoked. I'm grateful for that, but my parents did for a period of time until health issues forced them to quit. And, you know, they were lucky that they were forced to quit at 40, and now at 81, they've been, you know, non-smokers for 41 years, but they said it was absolutely the hardest thing they ever did. And, you know, people that smoke, they'll tell you that nicotine addiction is very, very challenging. So they can become addicted. They can have the mouth and throat irritation, coughing, wheezing, asthma challenges, and then there can be cardiovascular issues, including racing heart, racing blood pressure, you name it, and then gastrointestinal issues as well. So it's better or easier to stay out of trouble than get out of trouble. So, you know, if you don't vape, don't even think about it. You know, there's really nothing good that can come of it. When we start looking at substance abuse, we certainly know that alcohol addiction, opioid addiction, cigarettes, all kinds of other bad substances really increased during the pandemic. And here's what they said. You know, people felt socially isolated. They needed some type of escape. So there was different types of risky behavior. And by the way, some of that was online for kids especially. And by the way, risky behaviors actually increase their vulnerability to the viruses. Now, here's the data. This is out of CDC, October 2020, and they don't have it any more recent than that, but the numbers are not any different. So if there were 1,000 COVID deaths, less than 2 of those 1,000 were in people under 18. And here's what I'm going to tell you. If you were under 18 and you died from COVID, in fact, if you were under 65 and died from COVID, there was something seriously not right with your physiology. Now, other people argue, look, if people went to the hospital, somehow people that went to the hospital, they received a protocol that put them at risk. And I have an awareness of someone I know that died age 44 on Christmas Day of 2020, went to the hospital, somehow did not do well with the medical protocol and was dead within a few days. In fact, died on Christmas Day. So that mom of 4 gone. Now I wish that we had been in touch before then. I would have said, look, there's so many natural things you can do, but it didn't appear that the hospital was a good place to go if you were struggling with COVID. And now here's the latest variant. How many times has COVID mutated? I don't know, hundreds, thousands. And this new version, they call it BA5. And notice what they say, vaccines and prior infections are proving less and less effective at preventing infections and reinfections. I looked into that a little bit deeper. That's the print that I could find, but there are some doctors saying the vaccine is not effective at all. So when you look at this article here, which was, I think, from New York Magazine, what are they showing but a 3-year-old girl getting her first shot? Now, what was her risk of COVID? About 0. And does this new shot work against a new variant? No. So I'm going to ask parents to do their due diligence and make the right choice for your family and your children. So this was a question I received via the internet. It wasn't the parents' top 10 concern, but this person said, I'm concerned about the vaccination schedule. How many vaccines are they getting? What are the ingredients? Are they effective? And is there any study on the vaccinated versus the unvaccinated? So here's the vaccine table. And so notice 28 doses by age 2, 35 doses by age 5. Some of these are multiple doses. And notice what it says, as few as 23 individual shots by age 5. To me, that seems like a lot. Keep in mind, I was a child of the 60s. I grew up in 1960, born in 1964. And my parents, they bought into the idea that vaccines were good. So I had all of mine, 4. And I don't know how old I was when I got them, but I promise you, I wasn't injected for hepatitis B ever, and especially not at birth. So I want you to just do your due diligence and find out how much at risk is a newborn infant for getting hepatitis B. So how does one get hepatitis B? Anal receptive homosexual sex or the sharing of IV drug needles. And you might ask the question, okay, so why are we in such a hurry for that shot? It's a fair question. I want you to take that up if you are considering this. Take the schedule with the pediatrician, talk about each of these things and find out, which of these make sense. And I like to talk about the vaccine history. So, Jenner was the guy that was given a lot of credit for modern vaccinations. And interestingly enough, he noticed that milkmaids did not get smallpox, but they got something similar called cowpox. And cowpox was a much more mild circumstance. But here's how they would actually vaccinate back in the very beginning. They would take someone that had smallpox. In this case, it's talking about cowpox, but they would take a smallpox blister. Let's say I have it on my arm. They would cut it open, and then they would take some of the fluid from the actual wound, and then they would scratch that into a new person. Now, when they had cowpox, it was about 98% effectiveness, and about 2 of 100 people would get a serious case, and some of those would die. But that was pretty doggone effective. And this was the experiment, or at least an artist rendering of it. They actually took a cowpox blister, cut it open, and then they put it in the skin. And guess what? The kid then later was exposed to smallpox and did not get smallpox. So this was a good transfer of immunity. And this started the concept of vaccination, which, by the way, VACA from Latin means cow. So literally it came from cowpox. Now, here's another passive transfer of immunity. And this was the very first Nobel Prize winning medical experiment. There was a flu pandemic in about the 1900s. And what they would do is they would actually take the fluid portion of the blood called the plasma, and they called it convalescent plasma, and they would actually infuse it into people. Now, there were two studies when COVID-19 came out. One proceeds National Academy of Science, one New England Journal of Medicine, both had 100% cure rate. So when I was concerned about COVID in 2020, and I was, for my parents, not for me, I purposely went out and got COVID. I got it in 2020, beat it, no big issue. It wasn't a walk in the park. I definitely felt like I had something significant, but why did I do it? Just in case my parents needed convalescent plasma. Fast forward a year and a half later, 2021, they both got it, 80 years old. They were over it in a week without any issue at all, with all natural remedies. So, healthy bodies can handle this. But now let's look at what's in vaccines right now. So this is cdc.gov. You can look at this. These are additives and ingredients. So mercury, is in some. Aluminum, which is the most abundant neurotoxic element on the planet, is in some. Sugars, egg protein, formaldehyde. Do we want to inject these things into kids? You might want to ask that question. And then some of the vaccines have something in it called WI-38. And what is it? Those are actually cells from an aborted fetus. So again, verify this, do your own due diligence on that, and then ask yourself the question, do I want that injected into my child? And if you do, God bless you. I wish you the very best. And if you don't, maybe make a different decision. So now, how effective are vaccines? So we go back to death rate from infectious disease. This is very easy to find. Just go to, Google death rate from infectious disease, US 1900 to 1996, and you can see this graph. And what you'll see is a 75% reduction in death rate from infectious disease before antibiotics, 91% before any level of widespread vaccines in the 1950s. And how have we done since then? So there's your homework. Look into that and just go ahead and figure out how effective has these vaccines been at reducing the death rate from infectious disease. And then there's been a study. The Children's Medical Safety Research Institute looked at kids that were vaccinated versus non-vaccinated. And do your homework, look at that and see, and then maybe do your own poll. If you know parents that have non-vaccinated kids, maybe ask them how they doing versus vaccinated kids. And interestingly enough, when there was a concern about bioterrorism, you'll notice that this was a 2006 article, but Paul Stamets was hired by the Department of Defense. He's the world's foremost authority on medicinal mushrooms. And very simply, what they found out was that if there was an anthrax or a smallpox or even HIV, that mushrooms were defensive against it. So my favorite, Ganoderma lucidum, also known as reishi, I'm going to tell you, don't take my word for it, but go to pubmed.gov, type in Ganoderma and HIV, type in Ganoderma and whatever virus you want, including the one that gets a lot of press. And I think you'll be happy to see that there are rock solid peer-reviewed studies that this has direct antiviral action as well as enhancing immune function. Now, people asked about education. Are kids getting a good education? Well, we go back to 1973, and over 60% of people were very, very confident in our education system. Then, somewhere around whatever it was, 2016, it was 30%. So less than half of that. And the numbers were almost the amount of people that were, had very little confidence in the education system. Now, I haven't seen 2018, 19, 20, or 21, but here's what I would predict. Confidence has gone down and dissatisfaction has gone up. And just look at that. What are they teaching our kids in school? In education, 4 C's of education: critical thinking, collaboration, communication, and creativity. And I might ask, if people were educated in critical thinking and they looked at some of the data that we shared, would they make different choices? And what I'll tell you is, healthy bodies don't get sick. We want people to eat right, drink right, think right, move right, sleep right, poop right, talk right, starting with mom's first meal when she conceives that beautiful child, all the way through gestation and then nursing exclusively for 6 months and hopefully for up to 2 years. And that's a time-proven way of enhancing baby immunity. The last question was about hormones, and especially with this, rapid jumpstart of puberty, especially in females. This was a time cover story, early puberty, why girls are growing up faster. Is it hormones? Sure it is. Is it fat? Yeah, fats are estrogenic. Is there something in the water? Yeah, hormones. How are parents and kids coping? Not very well. Kids are at huge risk when they have early puberty. So early menarche, which by the way, Mayo Clinic says less than 8. If a girl reaches puberty earlier than 8, that's precocious. Mayo Clinic says 8. Yeah, that's acceptable now. Well, I'll tell you what, that's not acceptable. But what happens when there's early menarche? Higher risk of depression, eating disorders, substance abuse, obesity, diabetes, breast cancer, and even early menopause. So if we go back to around 1840 in France, average age of menstruation was about 15. And even in France, it was down to maybe 12.4 by 2000. And that graph has continued. So we're at around 11 here in the US. And so, are there endocrine disrupting chemicals in our environment? And yeah, absolutely. So this was a 2021 study. Here's what it said. Exposure to endocrine hormone disrupting chemicals is ubiquitous, meaning we're all exposed to these estrogens and horrific things that are doing bad things to human physiology. And then what can it do? So this was a very fascinating study. There's your PubMed right there, but notice what it said. A significant association between women's oral contraceptives and prostate cancer has been shown. And so here's the deal. When women take the birth control pill, ethinyl estradiol, that's 100 times stronger than human estrogen. They pee out some of that super strong estrogen. It gets into the drinking water. Men drink it. And then guess what? They're at higher risk of prostate cancer. So what we want to do is be aware of putting really clean things in our body, mind, and spirit. And that leads us to questions, if anybody has any.
Yeah, I do actually have a question. So when it comes to like children's health and education wise, whether it's at home or whether they're at school or the workplace, what would you recommend that children can do to use less of their phone, and what tips could you use for them to really get their brain health to balance out the equation? You know what I'm saying? If you know what I mean.
And I'm gonna, after I answer my answer, I'm gonna throw it back to Carol, because that's an area of her expertise. But when you start looking at different education systems, I will tell you that in the mid 2000s, I was giving a seminar on children's health in Seattle, Washington. And in the room next to me was a massive teachers conference. And the director of the conference came over and said, you know what, we've identified over 30 learning styles in children. I think what we're missing is the health component. Would you come and speak to our organization? And I said, absolutely. And I talked to him about health. So understand, healthier brains will learn better. But what I loved about their system was they learned the kids' learning style. And so, if I'm speaking Greek to you, and I don't speak Greek, but if I could, you're not going to understand it. And here's what they basically said to me. If you're not speaking the kids' language, you're not getting their learning style. And, I will share that I'm trying to think of the brain researcher. His name was Glenn Doman. And he wrote a book in the 1960s, but he said every child, and he wasn't saying every child except for a different demographic or a different level of brain injury. He said every child has at least the inborn genius level of Leonardo da Vinci, considered the greatest genius of all time. And if we lead that child on the right path, then we can bring that out. And part of one of my magic phrases I learned directly from Glenn Doman, some pronounce it domain, and that is that bodies respond to frequency, duration, intensity, quality, and timing of stimuli. And so what they have is a group in Philadelphia called the Institute for the Enhancement of Human Potential. And if people were blind, if children were blind, they would actually use different light frequencies and stimulate it in the eye for a big portion of the day, and they would actually develop the pathways that were remaining. If they were deaf, they'd start with vibration, and then they'd increase different sound. They'd do it for the majority of the day, and they would develop those pathways. And if they were paralyzed, they'd have them move passively and all these other things. And what they said is many of the blind came to see, many of the deaf came to hear, many of the paralyzed came to move, and they all dramatically improved. But so much of what they did was movement oriented. So they said that the primary input to the brain is the body, and it was absolutely critical that these kids maintained a high level of physical activity. Then you start looking at Montessori systems, very, very different. That should really take over education, a whole different system, very interactive, and kids that go there perform so much better. And now I'm going to turn it over to Carol real quick and have her share her experience and expertise.
Well, that's a first. I have some expertise in Montessori. I am a Montessori trained teacher. The Montessori method is great for all children of any age, and they're actually using it now in dementia patients to help them get more hands-on. Maria Montessori's studies, now it's well over 100 years, showed that all children learn different. Each one is unique. They grow at their own path. But a lot of the learning that they do, they can learn more between the ages of 0 and age 5 than they'll learn from age 5 to 95. And a lot of it is tactile. It's tactile. So when we're teaching them something, the fastest way to their brain is to be able to touch. That's why babies always try and put things in their mouth. They touch because it's a sense of touch. So the brain develops the neural pathway so that they can learn something that's different. So, oh, this is hard. Like we have things that teach them soft, hard, scratchy, like sandpaper. So they have different textures. We have sound cylinders. So they focus on all the senses and all as early as we can get them in there. Now myself, I've been blessed. I have 3 children, one who had oppositional defiance disorder, one who has OCD, one who has autism. If you ever want to private message me about vaccines, please do. And my grandson looks like he has ADHD. So they all learn different, and that specific reishi we were talking about is quite fantastic with all of them, especially the hot chocolate. Back to you, Dr. Bob.
Well, and by the way, I have read at least 6, and it's probably 7 because I like 7s, different books on intelligence and brain developing and learning. And one of the best quotes from one of those books, and I have to find the author and give him credit for it, but here's what he said. He said, it's a very inaccurate question to ask someone, how smart are you? Whereas a much better question is, how are you smart? Because we are all smart in a very, very specific way for us. Now, even there's certainly overlap, and they used to talk about 9 major types of intelligence, but that's probably, well past 999 and growing at this point.
This chat is super quiet. Do we have a question? I see someone putting her hand up. Go right ahead.
Oh, we got Janelle and we got...
Sorry, Janelle. I didn't see you. 1 sec, Janelle.
Yep.
Okay. Hey, everybody. So my question, Dr. Bob, is I know you mentioned, it's healthy for moms to be, as healthy as possible as soon as they conceive. So my question would be, is it safe for a mom to detox? If so, how can they detox if they're pregnant? And what can they be doing to make sure they have a healthy body for themselves and also for the unborn baby?
Well, you're going to have a hard time getting buy-in from an OB-GYN as a general rule on this one. But here's what I tell people, they're always telling moms, don't do that, don't do that, don't do that. Now, I've had plenty of moms that have done it and no downside to it that I can see whatsoever. But when we detox moms, when moms come in asking for it, we use different things that are known as medical foods. And to be a medical food, there's 4 criteria. Number 1, guaranteed potency. What it says on the label is on the label. Number 2, guaranteed purity. No contaminants, no microbials, no heavy metals. Number 3, proven effectiveness in human clinical trial. And number 4, every nutrient is recognized as safe. So with those 4 criteria, if you looked at that as the criteria for something you were going to put in your body, you'd have to say, oh my God, every nutrient is safe, it's effective, it's good, it's clean, it's pure. Yeah, I want that. But you go and then ask most of the people that, when I've literally had people go to their OB-GYN on this, they would say, absolutely not. Don't you dare do that. And then they'd say, well, can I have McDonald's? Yeah, of course, all that you want, and you look at that and you go, there's a disconnect. So, if doctors are educated in functional medicine, then they should give advice on functional medicine. If they're educated in nutrition, then they should give advice on nutrition. If they're not educated in either, then they should defer to the expert. And here's what the expert would say, you know what? Sacred ground is pregnancy. And I want you to zealously inspect all things that you allow to enter your mind, your heart, your soul, and your body. Now, I'm a grandfather now. So now what did my wife do while pregnant, by the way, with our 3 beautiful children? Detox medical foods. What did my daughter and daughter-in-law do? Detox medical foods. How were their pregnancies? Smooth. How are their deliveries? Amazing. How are their babies? Off the charts in every category, in good categories. So, but people need to do their due diligence. And if anything's happened, I hope over these last 2 years is people are looking at things through a more discerning lens and developing their own critical thinking. So just imagine, you're about to have a baby. And by the way, I don't think you are, right? But let's just say that you are. And then you sit down with your OB-GYN and say, I understand that you want to inject for hepatitis B as soon as my baby comes out, right? So tell me about that. What's the risk for hepatitis B? How does one get that? And then they'll look you in the eye and say, well, that's anal receptive homosexual sex or the sharing of IV drug needles. Oh, okay. Well, what makes you think this child's at risk? Well, you don't know how they're going to grow up. Okay. Well, what else is in that shot? Well, I don't know. Wait a minute. You're injecting what you don't know in my child? Because I went to the CDE website, and there's aluminum, which is neurotoxic, and there's formaldehyde. And there's aborted fetal stem cells. I'm not sure if that's one in the Hep B or not, but I'm not comfortable with that. Tell me why they're in there. Well, they're in there because they're proven to work. Well, so how much have vaccines dropped the death rate from infectious disease? Oh, a ton. Oh, here's the graph. Explain that to me. What am I missing here? And if we have that good conversation, I think a lot of people are going to educate their pediatricians. At least that's what I hope happens, and their OB-GYNs.
Okay, I was wondering on that I think it's a CTS, is that right? CTS 90, that brain. Okay, so what age can they start doing that? And I've got 2 nephews that are special needs, and one is 15. He just turned 15, and the other one's 8. And I thought both of them could.
Well, I'm pretty sure they can. So the youngest study I saw, I think it was 6 years old with attention deficit, and they did very well with it. But they have to be able to sit in front of an interactive screen and follow some balls. And so, I would even think that even younger than 6, they could potentially do that.
Because he did it here at my house on mine, and he liked it. And his mom's like, oh, I don't know, it's a computer thing. I'm like, it's 7 minutes.
Yeah, well, and then, you could potentially put on blue, I actually don't know if blue blockers would work now that I think of it, because you got to have the 3D glasses on, but you could actually do it in 2D mode and maybe with blue blockers. But, yeah, you're right. 7 minutes with proven benefits in every demographic. I would do it for sure.
Okay, and I have a question then. Our drink, CX, is it 90?
CXT.
Yeah. What age can they start?
Well, the only potential concern would be caffeine. And so whenever you're comfortable with a child getting caffeine, but, here's what we know. And we used to think that, people just took caffeine and you give it to kids, they bounce off the wall for hours, but there's calming agents within it. It's got cordyceps, it's got the reishi, it's got theanine, it's got green tea, it's got lion's mane, it's got B12, it's got a probiotic, and then it's got 100 milligrams of caffeine. But there's plenty of good buffers in there. So I would say, whatever age they start wanting to enhance cognition, that could be 3, that could be 4, but even with that said, my nursing daughter and my nursing daughter-in-law, so I guess my granddaughters have got it through mother's milk, and again, they're epic children. So in that respect, and I guess they even got it from conception forward. So again, super clean, organic, pure, health conscious. Back to caffeine for a second. So caffeine is found in over 60 species of plants. It's a natural insecticide, and that's why plants have it. And there's other certain benefits for the body. And so probably the biggest issue with caffeine is for people that don't detoxify it effectively. But when we add Ganoderma to it, those detoxification pathways improve substantially.
Okay, they've just put, is autism reversible / curable?
I think that's going to depend on who you ask, but when you start looking at this diagnosis, there's going to be a profound spectrum. And someone might ask, well, wait a minute, is there an advantage to it? And so keep in mind that Elon Musk is autism spectrum. Carol's son Tristan is a walking genius. And even though he's been diagnosed in the spectrum, so, it's a different kind of brain, but can you normalize it? And the answer is you certainly can, to a degree. So there's a book called The Brain That Changes Itself. It's written by Norman Doidge. And they talk about strategies to help these kids. And so if kids are really, really sound sensitive, they'll put them in a room and they'll play one tone. Now, I'm not very good with tones, but consider that the scale would be do, re, mi, fa, sol, la, ti, do. So they'll play do, 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 do. And when the child handles do, then they go re, 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 re. And when they handle re, they go mi, mi, mi. And at some point they go do, re, mi, do, re, mi, do, re, mi. And they handle it. And next thing you know, they're going up and down the scale without issue. And what about people that are touch sensitive? Then they start out very simple. So let's say someone's very touch sensitive. Well, maybe one spot, let's use maybe the back, because that's not very sensitive. Hands are sensitive, faces are sensitive. But let's say this was my back and I just touch the back. And then I touch the back. And then I touch the back. And when they can handle that, then I touch and I rub. And then I touch and I rub bigger. And then I touch and I rub bigger. And then maybe I get up to the back of the neck, which is going to be a little bit more sensitive. And they handle that. Then I go around to the front, and then you get to the face a little bit, and then you get to the hands, and they can desensitize in a very progressive, graduated way. And sometimes they're even light sensitive. So you start out with a very dim light of a very friendly hue. And firelight is a very friendly hue. Blue light is not friendly to most physiology. So you have a little firelight. And it's very dim, and then you make it brighter, and then you make it bigger, and then you start changing the hues. But it's just, you could almost use the term inoculation. They just, inoculate them with small doses until they can handle it better. And there have been some absolutely epic turnarounds. I have a video, and I should put it on my Facebook page. But this family had a profoundly autistic child, and they wanted all my help, and they wanted all my assessments. And I had to draw blood from this kid, which was my worst blood draw experience in the history of my life. There were 5 adults holding down this screaming kid. I'm pretty sure we scared everybody in the entire building away. It's like, what is going on? I'm surprised the police didn't arrive. But when we drew his blood, we got some very important data. So, thank God it wasn't for naught. We found some very significant things in his chemistry. And then we addressed them. And then within a few weeks, when this kid came in for a blood draw, he was like your average 6-year-old. He didn't want it, but it didn't take anybody to hold him down. And then he was sitting on his mother's lap, and as we did the video testimonial, and his name was Dogan. And I asked, okay, Mom, 0, no change, 100, perfect, ideal. How much better is Dogan in 2 weeks? She says, I would say 60%. Then the following year, normal first grade and all the way through school and doing really well. So now in his case, we had a very specific biochemical abnormality that very, very fortunately with functional testing, we found and improved dramatically. And it just happened to be a methylation challenge with the marker was homocysteine, but it also creates, big red cells, macrocytic anemia. So oxygen is not delivered as well to the brain and body. And we used a cream. We used something called neuromethylation cream with all the activated Bs, and mom would just rub it on them, and this kid got better by the day. So it was a fun case, very, very, very fun case, but extreme turnaround. Looks like Ashley has her hand up. So happy, beautiful day, Ashley.
Hi, I was invited by Diane Solana, so I wanted to give her a thank you for being able to come and listen to this because it's been amazing just to hear you guys. My son is 5 years old and we're about to get our official on paper diagnosis of what I'm expecting to be autism next week. And so it's just kind of interesting to hear the functional medicine side of this. This has been something I have been working since I found out when he was 3, looking for people because this isn't information that I was aware of that we could do. And I've seen changes all along the way. We've done gluten-free, dairy-free, nut-free, he's done that forever. But I keep seeing changes, but I feel like we're at that next move. He's never had functional testing. I'm looking for a functional practitioner to help me on the next step. So it was just I just wanted to thank you, and see if you had any suggestions, I guess, on where I should go next.
Well, welcome. You have a beautiful smile. Where are you located?
I'm in West Virginia.
Okay, so there's a group called DAN, Defeat Autism Now, that was actually one of my mentors, was one of the co-founders, Dr. Sidney Baker, and he started doing this in the 1990s. And he actually found gut health, microbiome absolutely critical. And it doesn't even necessarily take functional testing. Gluten-free, dairy-free is a great start, but a really good probiotic. And I tend to research things pretty thoroughly. And there's even a company now called Microbiomes Lab, and they shared data about something called the Megaspore probiotic, where they get the most effective and lasting changes in the microbiome fastest. So I would make that recommendation on top of it. Heavy metals tend to be almost universal. And then you also start looking at potential, hidden infections, stealth infections. So getting that immune system good, especially with reishi, is really quite good for that. And by the way, new data, and I'll have to look at the publication date, but for the way that the body naturally clears heavy metals is by creating a protein called metallothionein proteins. Now, a lot of people haven't heard of that, but the thione in that metallothionein is the same as the thione in glutathione, which glutathione is considered the body's most powerful detoxification agent. These metallothionein proteins, the new data is that they are increased by about 800% after dosing with reishi. So very, very powerful there to clear the heavy metals. But so I would look for a DAN practitioner, Defeat Autism Now, somewhere in West Virginia, get the good testing. And, clearly your son has an amazing mom. So I'm predicting a beautiful future for him and you and the whole family.
Thank you. Really
You're
appreciate that.
Another question. How often is it recommended for someone to do an enema?
Well, this is an interesting question because if you have ideal bowel function, you may not ever need to do one, which is so interesting. But I'll share, I'm part of a mastermind, and there's a woman in this mastermind named Susan Johnson, and she's profoundly forward about everything. Her child beat childhood cancer. So she became a health advocate, and she says, I help other families beat childhood cancer. But, on this live Zoom in front of thousands, she said, well, I start, someone said, what do you do every day? She said, well, I start every day with a coffee enema. Well, do you need one every day? Well, maybe not. But once in a while, the idea of putting coffee up your backside, by the way, make it room temperature, please, not piping hot. But the primary job of the liver is to detoxify the bowel. And there's something called the portal plexus. So there's a direct vascular connection from the bowel to the liver. And you put coffee in your backside, it goes to the liver, and coffee is known to cause the liver to dump bile and toxins. And I tell people, if you really want to get the benefit, do a reishi-infused coffee enema, because now you get all these powerful antioxidants, antimicrobials, detoxification agents, alkalizing substances, et cetera. And that would really take it the extra way. But here's what I tell people. You need to poop every single day. When it goes to eat right, drink right, think right, move right, sleep right, poop right, talk right, poop every single day, preferably more than one time a day. And if you're not going, well, guess what? An enema is a way to get it done. But there's different ways to increase magnesium. I tell people that fiber, water, and neurologic tone are the things that get the bowels moving. And if you're not going every day, there's probably something not right in fiber, water, and neurologic tone. But here's what we know. There's a whole bunch of people, and ladies, I don't want to call you out, but sometimes ladies are more vulnerable to thinking that pooping is socially unacceptable. So they'll hold it and they won't go in public, and they'll suppress their colon reflex. And that in the long run can cause big problems. So go every day. When you got to go, stop what you're doing, find a restroom and go.
I think there was a question that came up, but I didn't catch it.
Let me see if it's in the chat. Oh, how long should someone hold the coffee in? As long as you can. It doesn't have to be the enema where you go right away. There's like saline enemas or soapy enemas where you're just supposed to dump right away. But the coffee enema is a retention enema. So you bring it in and you don't even have to go right away. Let your body absorb it, and your liver and colon will do the magic when they're ready. But certainly go every day. All right, well, if there are no other questions, I'm going to wrap up with 4 questions, and here they are. Question 1, why'd you take the time to join us tonight? And there's so many other things you could do. Second question is the answer to the first, why not? Every week, we're going to share information that hopefully is relevant to a broad group of people, that if it doesn't affect you and your loved ones, it probably affects someone you know. Question 3 is, why not you? Someone's going to take some of this information and apply it. And I hopefully know that people are going to be more diligent about our kids and what we essentially allow into their bodies. And that would even include internet stuff. I didn't even realize that this was as big a challenge as it is. And I'm glad I did the research, because, oh my gosh, it seems that, the internet is a big risk for our kids. And then the final question is, why not now? So I would like everybody to take a positive action for your health, and especially our children's health. So we'll wrap up with these words. I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful. So good night all, and God bless.
Great on you guys.
Thank you.